Hello, my name's Alan Abramowitz. I'm the CEO of the Arc of Florida. And today we have a guest, Anthony Mancuso, who's going to talk about a bill that's coming up on March 18th, which is tomorrow. And also, it's coming up the next day involving medication and the use of a EpiPen on a child by a direct support professional. So first, I'd like to introduce you to Anthony Mancuso. Where are you from anyway? And tell us a little about yourself.
Well, hi, Alan. I'm from Sebastian, Florida. Living here 16 years, originally from Long Island. Um, it's my wife, and we have a special needs son who went to Wabasso School for a number of years until he aged out. And as time has gone by, we would be taking care of him. We always took care of him. We've always been there for him. And unfortunately, because of his special needs disabilities, he did require, some hands-on care with regards to he has a VP shunt, he has one kidney, and unfortunately, he has diabetes now. But we always thought that he would be doing well and do fine. He's healthy looking. In fact, this is my son. He's 35 years old. He looks like he's about 14, but he's 35 years old. He's got a big smile, always smiling, always happy. Um, but unfortunately, as time went by, we started to age. We never thought we would, and we honestly tried to stop it, but we continued to age. And now we've reached a time in our life where we're very concerned about his future. Well, who's going to care for him? We have no family. I'm a cancer survivor, 74 years of age. My wife has neuropathy. She's 76 years of age. And so it's becoming more and more difficult. And the reality is that we understand and know clearly that one day we're not going to be there for him. And we thought we had some options. We thought that we planned long enough in advance that he would have the opportunity to go into a group home and that would become his family, where he would be loved and cared for and have an opportunity to interact in the community and have a quality of life in his remaining years, whether they be 10 years, 20 years, or 30 years. So 5 years
So
ago,
where's Adam living now?
he's at home with us
And how long has he lived with you now?
uh, all his life, all his life.
And so you sought out a group home. So you thought you had a really good placement. You thought you had everything
Yes,
taken care of.
that's correct. 5 years ago, we partnered with Arc of Indian River County and actually assisted in having a fragile group home constructed so that one day he would be able to go in. With regards to that, we took our limited retirement funds and helped fund not only the group home, but to help fund other special needs individuals to go into this home because this home was built for 6 people. And so 5 others would be going in through our efforts to help get the house built and for Adam. And the house was finished and we were preparing to bring him in. We went through the whole cycle of introduction into the house, indoctrination into the house. His furniture was in, the room was already in. And 2 weeks prior to him going in, uh, his endocrinologist mentions to us, listen, he said, not a big deal. He said, but we have to, we have to have him have an insulin shot. The pills that he was taking were helping, but they were starting to wear out because if you know anything about prescriptions, after 10 years or so, they tend to start to wear out and you need to change the prescription. He says, but I think that a insulin shot with an EpiPen, and an EpiPen, by the way, is not a syringe and a vial and like you're looking at one of these Dracula movies where they draw it out. It's a simple little pen. It looks like a ballpoint pen that is something that he could take, and he felt that the endocrinologist that it would really help, really, really help his diabetes. So I happened to mention it to the group home. I said, "Well, by the way, he's going to be getting one shot every morning, and I can already tell you that I think he's going to really, according to the doctor, do well with it. Well,
And let me ask something because I don't know this. When you give someone an EpiPen, um, or is that considered a shot because you have a needle on it? It's a very small needle.
it's considered an injection, but then again, when you draw blood to just do his blood sugar count, it's the same thing, except the needle for the to do the blood sugar count is a little bit larger than the needle for the injection.
So
It's kind of ironic.
it sounds like what you're telling me is the group home could give um, draw blood and do things like that, but they couldn't that was like an obstacle for him moving into the group home.
The obstacle was for him to have the EpiPen to inject the insulin was the obstacle, not to draw the blood for the blood sugar count, but to give the insulin. And here's the ironic thing about that, Alan. You're drawing blood when you're doing when you're doing the count for his blood sugar count. But when you give the insulin shot, there's no blood. It's just
Yeah.
injecting a little bit of insulin. And let me explain something very clearly. It's like they call for, like in my son's case, 4 units. It's prescribed by the doctor. It's the pen is just dialed to the 4, and it's like it's not. I don't want to use the terminology. I don't want to be crude, but it's almost like a spit. It's so little. It takes 3 seconds to do. Once you put the injection in, it's three
Do
seconds.
you do you
Seconds.
have an EpiPen on you by chance with you right now?
I have it in the other room, Alan. If I
Let me
could.
press pause and get it, okay?
Okay, so
Anthony,
yeah,
can you show me the EpiPen? And this is what I want you to do is uh, tell me what they told you to train you to do it. And I'm assuming you are the one that does the EpiPen for
that is
yourself.
absolutely correct.
So give the instruction they gave you and talk us through it and show everyone what an EpiPen looks like.
Okay, and I'm going to show it to you in real time. And actually, it takes longer for me to explain it to you than it is to actually do it. So what happened was when I took my son in there, his blood sugar count was getting a little bit high and a little concerning. And when I went to see the doctor, the endocrinologist said that, I think it would be really good that he gets an insulin injection. It'll only be 4 units, it's hardly anything. And I want you to give it to him starting tomorrow. So I mentioned to the doctor, I said, well, yeah, I'm really not too keen on needles. He says, oh, you're going to give it to him starting tomorrow. And he gave me a sample and off I went. That was my extent of all my training. Totally, totally. In fact, I was lucky I got even a word out of him that I had to use an EpiPen. So anyway, the next morning, after I got over my anxiety, I got my EpiPen. This is it right here. This is it. And I'm going to show you what I learned by myself, self-educated. Takes me exactly 3 total minutes to do. So when it comes time to do it, I can go over, I pull the cap off, I get the needle that goes for it. I first clean the top with a little alcohol. I put the needle in, I screw it in. I turn my dial to 4. There's a little dial thing here to 4. I go over to my son. I clean his arm a little bit and I give him the shot. Done. That's it. What did that
And
take?
what do you do with the EpiPen then?
The EpiPen is good for 28 days. At the end of the 28 days, I dispose of it appropriately for any type of medication, as if I was throwing away a bottle of pills or something like that. So this lasts 28 days once you start to use it, and then you get the next one. And after 3 months, you go back to the doctor, he checks the A1C to make sure everything is going good, and you go on with this. I've been doing this now for a year and a half.
Let me ask you this, because I know you've talked to me earlier that there's a number on like two, three,
That's
four.
correct.
Who decides what number it is?
The endocrinologist, and only the endocrinologist. And you do not have the flexibility to change the number on your own.
And
And
so I guess it would be like an analogy would be if you're taking pills that, let's say you're supposed to take one pill a day, that they could accidentally give you two or three, and that would be a problem. But here, they tell you exactly what to do. So you got to give the right amount, but they tell you exactly what to do.
right. Let me give you a little bit more clarification on that, okay? Because in my home, my son takes 3 diabetic pills plus the insulin shot, okay? We could overdose him if we gave him 2 pills extra that would be a problem. There's nothing different from the pills than it is to the injection. In a group home, he actually has a better opportunity to continue to get the right dosage. For example, when I was told I have to give him the EpiPen injection, did anybody ask me, do I have dementia? Did anybody ask me, am I epileptic? Did anybody answer that I'm an alcoholic or anything that could possibly cause him harm? No, nothing, nothing at all. You're the dad, here you go. Uh, so I found that to be very awkward. In the group home, two things I have to clarify. When he was going in for the prescriptions, the group home takes his pill. Each one, they put it into a little plastic bag. They date the bag with a little sticker. If it's for lunch, the date, and his dosage. So every single pill is identified by what it is and when it's going to be utilized. Other than the house, you open up the bottle, you give him his pill, and you go along your way. Thank God we're sane, we can do that. But the group home has a good system. When it comes to this, all they have to do is the appointed person, if it's a direct support professional or somebody in that category that can look at it and say, okay, you have your book, you have your instruction manual right there all the time. 4 units. They click the 4 units. They call over the manager of the house, who's also been trained. She verifies the 4 units. They give him the 4 units. That's far more protection and control than of a parent or any family member just doing this. And by the way, they gave me the option. I could have asked any family member to do this. I didn't have to be me, just had to be a family member. So
Now, so let me ask you this. So like 5 years ago or whatever, you're trying to get in the group home, and this was the only obstacle now from it happening. And if you go to the statute and the rule, it doesn't specifically say auto injector or EpiPen. There's lots of different words for it, but we all know what we're talking about. But because of that, they felt that they'd be breaking the rules of the law to let him go there, even though it seems pretty simple.
that is correct. And beyond that, what they have decided is that because my son has to have a little injection with an EpiPen, which is simplistic as possibly be, he's being condemned to basically being condemned to death because they're not giving us any other option but to put him into a nursing home. Now, as I said, my wife and I aren't in the greatest of health. We're getting older now. The life expectancy is we're pretty much right about there. And we are extremely concerned the welfare of my son. What's going to
Let,
happen to him?
let me ask you this, okay? Because just so you know, Chapter 393 has a statute about what a direct support professional, or what the statute currently says, direct service provider, which is they're trying to fix that in the bill too. But it has a string of things that people can do that do this work, and one of them is like ophthalmic. They could do that. There's a whole list of things, and I think all they need to do is probably put the comma in the word auto injector, because underneath it is the training section, and it would be added there too. Even
Mhm.
though you didn't need training, they would do training also. So it seems like it could be a simple fix and would open up the world for a lot of families. So in your situation, your choices are limited. At some point in the near future, your son's going to have to go into a nursing home, which you do not want to happen.
No,
Two, you have to move to another state that allows it, and you're
right.
very happy here, right?
I'm very happy here. We came here because that's where we want to be. We retire here. We do it, the remaining years of our life would be happy for everybody. Our son would be safe and protected and loved. And what's the difference? And when you look at it, think about it. Uh, the American Disabilities Act says that every disabled person should have the opportunity actually should absolutely have the opportunity to be in the community and to have the right to have some quality of life and not be put into an institution. And what makes the difference? It's not the building, it's what goes on inside that structure that makes it a nursing home or makes it a group home. And I don't see too much love and care and family atmosphere in a nursing home. I see it in a group home, and that's where I want my son to go. And
So
I mean, if I'm going to die first before him, because I won't put him in a nursing home.
So so all that you're asking for, and I know you were the one that met with Senator Grawl, and she was very interested in this. She's very passionate about helping people with disabilities, and she ended up filing this bill. So we appreciate her very much.
Yes, we certainly do.
And and it seems like if they make a small change, it changes your life and your family's life forever, and it improves the quality of Adam's life.
Right.
So he can now have, I guess it's the fear that you could die at any point. What happens next?
Right. And that is a fact, you know. After age 74, every day is a God's blessing. And and I really have to say that it's important that my son's the most precious thing we have. And for every parent who has a special needs individual, it's the most precious thing that they have. But diabetes in the state of Florida and in the United States is on the rise significantly. The age of caregivers is on the rise. They're getting older, you know. So they, you know, the state sometimes says, "Oh, well, you could put them in a foster home, and or you could have them adopted." Well, I got news for the state that unfortunately, even if they're foster care or adopted, those caregivers age also. So ultimately, you reach a point where you have to put them in some sort of facility, unlike a nursing home, a home, like that's why I like to say group home, where they can have a quality of life and have a family, and their other residents there becomes their family. And the American Disabilities Act is very clear with regards to that, you know, under no circumstances should they be institutionalized when there's an opportunity to put them into a community setting. And it's not just talking about my son. The last time I did my statistics, I think there's about 108 special needs children that are in nursing homes right now who shouldn't be in nursing homes because they got diabetes. So what does that tell you? It tells you
So
that in
it's
the near future, there's going to be more people in the nursing homes and more families that are destroyed because of this decision.
and it seems like all you're looking for is a practical and safe solution for individuals with disabilities who not need access to medication administration that is an EpiPen, a very simple
Mhm.
process. And that would, and if the legislature does this, that would improve access to care. It would reduce unnecessary institutional placements for a lot of people around
Mhm.
the state, and it would alleviate the burden on families.
Right. And if you look at procedure 65G-7, which is the medication administrative procedure, it states, well, you know what? If you need to tube feed the resident, that's not a problem. You can tube feed them. What happens if you're putting too much food in their tube? Well, why is that considered acceptable? But a simple EpiPen that takes about 3.5 seconds to do is a violation of the procedural rule. 65G-7 is an antique procedure. Times have changed, and
Yeah,
the medication process has changed for the better.
it sounds like if you've been around a group home and the things that they do for the people they serve, these direct support professionals, that this would be low down on the list of complexities.
Very low
And
down.
in
Hey,
the yeah, very
I'm
well. And
doing
the
it,
other
Alan.
thing,
Can't get much lower.
the other thing is the cost of a nursing home is substantial. And if he could live in a group home with, supports, it's going to save the state money too.
Right.
And he may live longer though, so that may cost a little more money because the life expectancy would
Mm.
be greater. But I just want to give you one last chance. If anything else you want to add before we wrap this up.
Yeah, I just want to say that is as a parent of a special needs son, I'm really here to plead that you will pass the law that we're trying to get through and help all these other families too, who unfortunately, for whatever reason, can't get their voice heard because this is a terrible thing that we're doing to innocent people. And as I showed you in the picture before of my son, does he look like somebody who is condemned now to go to a nursing home just because he gets an insulin shot? And he's been getting the insulin shot for a year and a half. And look at him. Why should he be in an institution where his life is going to be over in a year or two? It's wrong.
Thank you, Anthony. I appreciate that. And, we really asked the legislature there's two bills coming up this week, and it's the first committee of reference. Each bill has three committees of reference, but the first one is the policy part of it. And it is Senate Bill 1736, filed by Grawl. And then the one we're hearing tomorrow is House Bill 136. And that was filed by, do you remember the representative on that bill?
Representative Turk?
Uh, Representative,
Turk. Turk. I think it
Sa-
was originally was Representative Trademark, but I think it was turned over to Representative Turk.
yeah, yeah, okay, yeah, she's out of the Wachula area. I remember that. But anyway, we're hoping, and my thoughts on this is I recall 2 years ago, I think it was Representative Tremont passed a bill where family members could do some nursing care for their family members if they're trained. And it was a great bill. It saved money and it allowed them to do it and get paid significantly less than the Medicaid rates. And it's been over a year and a half. They still haven't implemented that bill. And I know Representative Tremont has been frustrated a little probably by that. And he's a great advocate. And I'm hoping on this one that we make the legislation as simple as possible so it can be implemented as soon as possible. And Anthony, thank you for your time today. We really appreciate your advocacy.
Thank
We
you,
really
Alan.
appreciate you coming up. Yeah, one last thing.
Mhm.
You came up here. Tell us the effort you had to do to be able to come up here for your son. I
Oh,
understand you're CDC plus.
yeah, I'm on CDC Plus, and thank goodness we're on that program because my wife can't be left with my son because my wife has uh, a significant level of neuropathy. So physically, she's not capable of really taking care of him. Um, and I had to bring in somebody um, who's a caregiver who can just watch our son and take care of him because he does require, to be, he can't chew and, he's incontinent. So, you got to take him to the toilet and everything like that. So there's a lot of finesse to taking care of him. So I had to hire somebody to watch him for the next 2 days. And so that's a pretty penny out of our pocket. Plus, when you hit around 74, 75, you want to stay local, like maybe down the street. This was a 6-hour drive for me in traffic on on the interstate, and between
And
two
what
trucks.
and I think the best way to end this presentation, Anthony, is tell us about your son's disposition because you were talking to me prior to we going on about your son. Tell us about your son.
Okay. Well, my son is a very docile individual. He understands English. He doesn't speak. Like I said, he's got a number of physical ailments, but he's a good person and he understands. He understands when people like him. He understands when people love him, and he certainly understands when people don't. And it's painful to see when somebody looks at him like he's a nothing just because he has a disability. It's very, very painful. I see it's painful to him and it's painful to us, and it's wrong. And I feel so bad for him. And I'll tell you the truth. They talk today and they say, well, you know what? Maybe you should have aborted him. If you knew at the time, why didn't you abort him? But you know what? God gives everybody a life, and they're special in their own way, and he's special in his own way. And I would do it over again, even if I knew this is what it would be like. I would do it over again, and it's not hasn't been easy. And as a family with special needs, you're out of the mainstream. You're not there with everybody. You're pretty much on the side street, and you're alone. And the only thing different between me and so many other families like me is that they don't have the voice. And I can't stand still and just watch everybody suffer the way it is. But we love our son. We always will. If we could live to be 1,000, we'd take care of him. I wouldn't even be talking to you today. But unfortunately, that's how life is. And for my son and for other special needs individuals, they deserve a chance. And this would be
So,
a chance.
so Tony, when I come down to Sebastian, will I be able to get a hug from Adam?
Sorry, you'll get a kiss.
Okay, I'm gonna hold you guys to
You hold
that.
me to that.
Well, I appreciate you.
I've been in training for that.
Thanks for your advocacy, and thanks for Representative Tuck and Senator Grawl for taking this on. We
Yes,
appreciate it.
yes. Thank you.